Okay, good morning, good afternoon, and welcome everyone joining us today. My name is Anastasia Buchuk. I work on the knowledge management of the Global NEP Update project. Thank you for taking time to attend this regional workshop on gender mainstreaming in national implementation plans, so-called NEPs, organized by the Green Growth Knowledge Partnership, GGKP, under GEF-funded and UNEP-led Global NEP Update project. As many of you know, national implementation plans are critical instruments for the parties of the Stockholm Convention to meet their obligations and manage persistent organic pollutants in a strategic, coordinated, forward-looking way. And under the current project, GEF 10785, many of our countries, the parties, are actively working on their NEPs, updating the chapters, developing POPs inventories. And as parties progress with their NEPs, we have received a few requests on how to better integrate the gender considerations into the process. Some of the parties reached out to us. They said, we've collected all the data for inventories. Now the gender is in question. So this virtual workshop is aiming to respond to these needs. And while there is a guidance, such as UNEP's guidance on integrating gender dimensions into the national strategy setting and chemicals management, we'll share the link promptly on the chat. There is a further support required to translate this guidance into the practical actions that would make difference on the ground. So today we will explore how gender roles, occupations, socioeconomic factors, they shape exposure to POPs, how these differences directly and indirectly can be recognized, addressed in the NEP updates, and what entry points can guide parties in mainstreaming gender better in their NEPs. So while we highlight the practical entry points from the UNEP guidance, we also warmly invite all participants to share their real-world experience, challenges, whether from the government. We have, I guess, the most of participants registered today from the government, but also from the civil society, community initiatives. So today you'll hear from civil society organizations that work in Africa, in Europe, and in Asia, with the vulnerable groups on the front lines of the chemicals and waste. You also hear from national experts and consultants that work on NEP update and integrating gender in these NEPs. We also want this to be an interactive discussion, dialogue with all attendees to discuss solutions, raise questions, exchange lessons. So even though today's discussion is focused on Africa, Europe, and Asia, we welcome everyone to participate from other regions as well. A few housekeeping rules. The online session will last up until 2 hours. It's being recorded. Interpretation is available in French and Russian. Please select your preferred language in the Zoom toolbar. And this is a workshop, so we welcome your active engagement in the chat, but also please feel free to turn on your microphone, your video, and jump in for the discussions. So most of the participants have been promoted to the panel. If you weren't yet promoted to the panel, but you want to speak, please keep your hand raised and we will assist you promptly to promote you to the panel. Finally, please take a moment to introduce yourself in the chat. We would love to know who is with us today. And we are delighted to begin our today's agenda with Susan Winfield, Program Management Officer at UNEP and Gender Focal Point at the BRS Secretariat. Susan will today remind us of the critical intersections between the gender, chemicals, and the Stockholm Convention. With that, it's my pleasure to hand the floor to Susan and open the session. Thank you very much. Over to you, Susan.
Thank you very much, and good morning, afternoon, evening to everybody, wherever you may be. It's a pleasure to be here, and thank you very much to the organisers, particularly Green Growth Knowledge Platform, for inviting me to share some opening remarks today. So looking at this important issue of mainstreaming gender in national implementation plans, I want everyone to look back a few years to 2023, when UV 328 was listed under the Stockholm Convention. I'm sure many thought about what it would mean for inventories, control measures, and regulatory updates within our countries. But there's also another question that we need to ask, and that is who is actually exposed to UV328 and in what ways? We all know that UV328 is used as a stabilizer in plastics, coatings, rubber, and even cosmetics. That means exposure looks very different depending on gender roles and circumstances. Men often work in manufacturing or recycling facilities where UV328 is present at higher concentrations. But women and children may be more exposed through cosmetics, household plastics, or toys. And then there's the informal sector, of course, where both women and men face risks, often out with the necessary protective equipment. These differentiated pathways of exposure remind us that updating a national implementation plan is not only a technical exercise. It's also about asking whose voices, whose risks, and whose needs are being reflected in the way we design and implement measures. I used UV328 as an example because it's one of the more recent chemicals listed under Stockholm and, of course, is quite topical given the recent talks on plastic pollution here in Geneva. But the same questions could and should be asked for many of the POPs listed. So thinking back to 2019, for example, where POPs like PFOA and dicafol were listed and restrictions on PFOS were tightened. In each case, there are gendered dimensions of exposure and use, whether it's workers exposed in chemical plants or women in households encountering contaminated products or communities living near sources of release. Integrating gender into NIP updates helps us see these dimensions clearly and act on them. We've also got valuable lessons from earlier NIP updates and case studies that we've undertaken together. And when I say we, I mean BRS Secretariat, in cooperation with the NGO Women Engage for a Common Future. For example, in Bolivia, consultations revealed that women waste pickers have high exposure risk but very little access to protective equipment. In Kyrgyzstan, the case study showed that women farmers mixing pesticides often have inadequate protection, and this has now led to training programs that have been specifically targeted to them. And then looking at Kenya, limited participation of women in decision-making meant that their concerns were often underrepresented, and this is a gap that was identified for future NIP revisions. Of course, we're not starting from scratch. Under the BRS conventions, we now have a gender action plan, which was just adopted at the COPs in May this year, and it's for 2025 to 2035. This provides a common framework to strengthen gender-responsive chemicals and waste governance. It's also calling on all stakeholders, so that's not only Secretariat as it used to be, but parties and all stakeholders, to integrate gender considerations into national strategies, to collect gender disaggregated data, and to ensure more balanced participation in decision making. These are exactly the elements that can enrich our NIP updates. Similarly, the UNEP gender guidelines on NIPs, which Fuad will go into in more detail, remind us that while exposure to POPs is universal, the impacts are not the same. Women may be overlooked in inventories and risk assessments or excluded from decision making, yet they may carry a disproportionate burden of exposure in households, agriculture, or the informal sector. The guidance offers very practical entry points from sex disaggregated inventories to gender-sensitive policy design and monitoring, and all of these can help us move from awareness to action. So as we begin this workshop, I'd like to invite you to reflect on a few questions. If you're updating your NIP today to address a POP like UV328, for example, or any other POPs listed in recent years, how would you make sure that gender considerations are included right from the very start? How could data collection be improved to capture differentiated exposures and impacts? And what good practices from your own experience could be scaled up across your regions or beyond to make NIPs more effective and inclusive? So before I finish, I just want to thank the organizers again for inviting me to join you. And of course, to thank you all for the important work you're doing to advance gender responsive implementation of the Stockholm Convention. Wishing you all a good workshop. Thank you very much.
Thank you so much, Susan. And that's very good points in the end on the questions to consider for all of us while we are listening for the presentations from the speakers. I guess these questions will definitely guide our discussions, and I invite all the participants of this workshop to share their ideas and answers and any insights on these questions that Susan just voiced in the chat while we have some presentations, and we'll get back to these questions during the discussion. Thank you so much and welcome everyone again. Let me introduce our next speaker, Mr. Fouad Berji-Gui, who is a co-author of the UNEP Guidance on Gender Mainstreaming in Chemicals Management. So he will share a very concise version of the guidance and a bit on the practical entry points that will help integrate the gender in the NEEPs. Over to you, Fouad. Thank you.
Thank you very much, Anastasia. Thank you, colleagues. It's a pleasure to be with you here today. I would just like to request permission to share my screen. And once done, I'll be able to navigate through the slides. May I kindly have a confirmation whether you can see my screen and whether the slides are moving?
Yeah, Fouad, we see your
Okay.
screen, the slides are moving. Go ahead. Thank you.
Fantastic. Thank you very much. So colleagues, a pleasure being with you here today. So let's jump in right into the conversation, and super, I'm excited to be able to navigate through the next slides and see what we're talking about today, and focus on the guidance that was prepared. So basically, let's have a little bit of a bird overview of what we're talking about here. So when we talk about gender, I'm sure a lot of you are really familiar with the concept. We're talking about a socially constructed concept, basically. Sex is biologically determined, but gender, the roles played by women and men in a given society, in a given development context, are socially constructed. So we're talking about the gender roles that are learned, acquired during the socialization of individuals as members of a given community. When we talk about gender mainstreaming, we are referring to the overall strategy. Think about the strategy you're going to be using when you develop your national implementation plans to make sure that everyone is able to benefit equally from the results expected from these development interventions, the projects, the initiatives that will be undertaken on the ground. So by having that gender mainstreaming strategy, but having those gender lenses, you will be able to make sure that everyone, women, men, youth, elderly, vulnerable social groups, are able, to benefit equally from your interventions. And of course, this will lead us to, by using these gender lenses, to recognize and realize, the fact that women and children, and men can be disproportionately affected following their exposure to POPs. It will enable us to break down the main narrative that says that, POPs affect everyone the same way, and to really understanding the disproportionalities and how, some population categories could be disproportionately affected and as a result of their exposures to POPs. So, and this is actually a good overview of the gender mainstreaming work that is being done by looking at a GEF portfolio, the Global Environment Facility portfolio of projects financed in the area of chemicals and waste. So there were two evaluations that we are mentioning here, one conducted in 2018 that found out that most projects actually were gender sensitive, gender aware, but we are not yet there in terms of our ability to deliver gender, transformative projects on the ground. So, and very few projects were really gender mainstreamed, which means that we still have a long way to go in terms of our ability to move in from gender awareness into gender mainstreaming, you know, on the ground, technically speaking. And our evaluation in 2024 confirmed that despite, again, all the efforts, there was a positive move towards having more gender-aware projects, but overall, the performance of these projects is still trapped in the middle. We're not able to deliver gender transformative impacts unless we are really able to, you know, to take our gender mainstreaming work into the next step. So here, when we look at the guidance, basically, we'll focus on the key entry points for you to be able to mainstream gender as you walk through the design and implementation and updating of your national implementation plans. So the first entry point here is during the stakeholder engagement process. So gender mainstreaming, again, this is the general rule of thumb. We have seen a lot of you know, practice happening on the ground, trying to simplify the count by, you know, bringing women and men into equal numbers, taking photos, posting them on social media. We had this workshop here, we had this consultation here, and you know, we see that women and men more or less on equal numbers are participating to the activity as panelists or as like participants. But so gender mainstreaming goes way beyond parity. Parity is a necessary step, you know, at the initial end of the spectrum, but we need to go way more than that. So basically, we need to make sure that when we carry these consultations for stakeholder engagement, we involve all social groups that are most at risk, including women and children. We also need to make sure that we have a good representation of all the targeted sectors, you know, so not just like women from working as farmers or like working in the e-waste, you know, sector, but also like in other sectors where they are exposed to POPs, such as, you know, occupational workers working on, you know, cleaning or exposed to cosmetics and so on, and other products containing or contaminated with POPs. We also need to make sure we create an enabling space. Bringing women and men, you know, in equal numbers to workshops is a good start. But what about their ability to speak up their minds? We have found in many situations that when you bring in women, you know, and into a workshop where they have male counterparts from their families present, whether it's the father, the husband, the brother, they might feel shy of, you know, speaking up their mind and echoing their concerns, you know, during the meeting. So we need to make sure we take these dynamics into consideration to enable them to really be able to participate and speak up. And the same thing goes to decision-making processes. We need to ensure that women are not just like there to you know, to be you know, to participate, but they're also able to be part of the decision-making processes, and that requires some empowerment to be done from our end as well. We also need to make sure that we're not just working with men and women from the formal sector. We should also engage those in the informal sectors, which could really be at a high risk of exposure to POPs. And we should also make sure that we have, you know, cross-sectoral and gender-sensitive communication channels, because when we establish these, we're able to reach out to the men and women who are not able to speak you know, the let's say the main official language of the country, but also speak the multitude of local languages that many countries, you know, have in terms of the cultural, you know, setup and environment in the country, with countries speaking dozens or even you know, over 100 of local languages. So we need also to be able to bring in these people to the conversation, and they could be reached through workers' union, family health centers, consumer protection associations, and so on. Different innovations we see on the ground happening. Now, when we do the inventories and monitoring, I think we should make sure that we have a gender balance, you know, established when we set up the teams in charge of inventories and monitoring, for example. We can include, you know, gender-specific wording in the terms of references to ensure that, you know, the workforce hired for technical and managerial position, you know, as reflects the gender balance that we would like to see actually happening. And of course, we can, you know, try to upgrade the monitoring mechanism that we have for POPs by also collecting. We can add additional steps where feasible. We're not just like interested in knowing, you know, how many tons of or stockpiles we have of this chemical in which area, but we also need to understand, the demographics, the socioeconomic dynamics within these areas, which could give you a little bit of a glimpse about the gender dynamics behind. And that could be done by collecting sex disaggregated and gender differentiated data within these areas where inventories are being recorded. Same thing when it comes to conducting gender-sensitive POPs inventory. The idea is to be really able to describe, document, and break down the differentiated impacts by sex and gender, associated with exposure to the chemicals being, subject to the inventory. Another key step here is when we look into alternatives to POPs. So every time in countries we look into alternatives, the question comes in, okay, so we are trying to come up with safer alternatives to POPs, which means creating new business models, creating new niches, new markets. And the question is, would women and men be equally able to jump in onto these new business opportunities? So if we are operating in contexts where women are still not able to access productive assets and financial services through banks, through their ability to own land, for example, and use that land as a collateral to borrow so they can start a small, medium-sized enterprise and so on, so they can be also part of that alternative economy to POPs, then of course they're not going to be able to to benefit equally as their man counterparts. So I think this is very important. When we also try to provide market signals, to mix of policy and economics tools that countries are using to incentivize, let's say, the private sector within a given country, so they can boost domestic R&D capabilities and build broker public-private partnerships towards detoxifying the way they do business by adopting alternatives or safer alternatives to POPs. Then, of course, we need to consider who will benefit from such market signals and mixed policies. And we should also make sure that the companies, the entities, the structures who will benefit also, we look at them through gender lenses. Do they have women in leadership positions? Is there, a glass ceiling that needs to be broken? And of course, by doing that, we are able also to provide the right incentive and make sure that, we do not exacerbate the existing gender inequalities, but we do it in a positive way to ensure like we are contributing to the gender equality agenda. So same thing in terms of providing sex disaggregated cost estimates of exposure to POPs. We need to make sure that we have that picture so we can prioritize those most at risk, including women. So when we do the cost estimates, we are able to identify the ones that are really at risk, at the highest risk possible, and then we can proceed by prioritization so we can address the ones that have, that are mostly impacted. And then, of course, when we do capacity building interventions, it's really very important to make sure that we do it the right way so we can strengthen the institutional capacities and the human capacities needed so we can accelerate the adoption of safer alternatives to POPs. And the way to do it is really to understand the caregivers and breadwinners roles actually associated with being a man or a woman in a given context, so we can make sure that we time these capacity building rights, we design them in the right way to enable a participation of both women and men equally. I think we should also be able to use context-specific approaches. Raising awareness is not a one-size-fits-all everywhere, so we need to look into our intervention context and try to reach out to women, other vulnerable groups, by using field schools, working with local volunteers that have an easier outreach to the community. Now, knowledge management is one of the key pillars of our work also. So basically what we see is that we have a lot of work that is being done, but it's an islands of a community of knowledge management that are like scattered all over the place. The idea is, how do we make sure that this knowledge is kind of codified, and we have a growing body of knowledge that could be used for people actually to take the lessons learned and improve the work on the ground. So I think here what the key takeaways is that we need to make sure that we break the silos. We have very good gender specialists. We have excellent POP experts that work with policymakers, but in different silos. So we need to break the silos and bring them all together to speak to each other, to cross-pollinate, so we are able to really build frameworks and do interventions that will make a bridge the gender gap and the knowledge gap in terms of gender mainstreaming and POPs management. We also need to build the institutional capacities so we can make sure that we translate the action plans into concrete interventions. And we need to invest again in gender focal teams. This is very important in many countries who are suffering from high turnovers. You identify a gender focal point, best case scenario in one ministry, institution, organization working on NIPS, on chemicals management in the country. That person, might move from one reason or another to another, like administration, a new job, a new adventure in life, and so on. And again, the institutional memory is lost. So the idea is really to have a gender expertise that is not really, within one circle, within, one actually portfolio, but that is diffused to different, individuals within a gender focal team. So if one individual is not there anymore, the the institutional memory is still within the organization, within the institution, and the work can continue on the ground. So the health aspects, I think it's very important for us here to be able to, when we explore the cumulative health impact and when we try to assess the real cost of exposure to POPs, it's really important to have gender lenses so we can break down that cost, based on the gendered, determinants of the health impact associated with exposure to POPs. So I think it starts with establishing multidisciplinary task forces, so we can really kind of mainstream gender consideration into the research protocols, the frameworks that are being used actually for, in environmental health assessments. We need to be able to invest in gender sensitive and sex segregated data so we can unpack the story that is being told about how, sex, gender, and exposure interact with each other in a complex way, and that affects how women and men are like impacted from their exposure to POPs. I think we need also to be able to assess the cumulative cost of exposure to POPs, including especially on maternal health and the health of future generation. That is super important to keep in mind every time we are conducting these type of financial assessment and the costs of exposure to POPs, so we can really kind of like unpack it using gender lenses. And we should also, I think, be able to have an increased level of awareness, and for people to be able to see the real actually scope of exposure to POPs among the general public, so we can kind of like have clear guidance on and emphasize on women of reproductive age among other vulnerable groups exposed to these chemicals. So when it comes to the socioeconomic aspects, I think, again, there's always a story to be told. There are a lot of invisible details. And I think here the key takeaways for us is to be able to ensure that, when we do awareness raising, we should make sure that it's adapted to the local context, and we should focus on including the population subcategories that are most at risk, including, of course, women of reproductive age, children, youth, elderly, and especially those working in the informal sector. We should try to the extent possible to assign low-risk tasks to women of reproductive age, in sectors or industries where they are exposed to POPs, so we can mitigate the health burden passed on to the future generation. Because when disease happen, when sickness is identified, then the socioeconomic impacts are really huge. We should also be able to develop tailored gender sensitive content when we have advocacy and awareness raising campaigns. We can use ICTs, we can use cognitive sciences, so we can make sure that we nudge the general public in the right way, so we can pave the way for change in terms of how do we usually do awareness raising on the ground. I think in countries where it's possible to de-risk investments in childcare facilities, that will be again something that will contribute to tackling some of the issues around child labor in sectors such as e-waste value chains. it's important to be able to promote safer and greener alternatives to energy sources, especially energy sources that create sources of pollution in the households and increase the exposure of women and children to POPs. And I think it's also important to keep in mind other solutions by working with other partners in the country in terms of our ability to facilitate access to social security, which means that will reduce the burden on women and children working, for example, in informal sectors, knowingly or unknowingly, because they don't have another choice. They would have to do the job anyway. So if they have access to social security, if they have access to training, to productive assets and financial services, they will be able actually to seek safer alternatives and improve the quality of their lives. So when we finance alternative to POPs, again, let's make sure that we have gender perspective in mind. We should, empower women to equally benefit from any alternative financing sources, whether these are traditional but also innovative financing schemes. In some countries where the use of mobile money and digital wallets is being used, grant-making mechanism or financing mechanism to enable, communities, individuals use, safer alternative to POPs. We should be able to ensure that women are also going to be able to benefit from such, innovative schemes. We can also promote gender-responsive microfinancing to ensure again that women groups are, are able to benefit from financial services, especially in context where they are underserved by traditional banking systems and financial institutions. And in cases where we have projects, there is also a good entry point for using gender-sensitive budgeting to make sure that we have dedicated specific budget lines that address the gender mainstreaming requirements of the project. That's it from my side. I hope I was focused enough to enable more time for the conversation and the interactivity to happen before we catch up again for the case study. Thank you so much, and over to you, Anastasia, please.
Thank you so much, Fouad. That's really great. A nice overview and a good start presenting the guidance. The guidance is very big. I think it covers very comprehensive aspects of gender per se, and also the gender in chemicals management. And we have a second part of this presentation by Fouad in the second hour of this workshop. But we also have some special guests today from the project and also from the civil society. I know that Melina from Bosnia and Herzegovina is here today. Melina, would you be interested to jump in and share a bit on the current NIP update in Bosnia and Herzegovina and how your country team is working on integrating gender? Just a quick introduction, Melina Valjeva, NIP update expert and a senior environmental expert at UNOVA, Bosnia and Herzegovina, working with us in this project. Over to you, Melina.
Thank you. Thank you very much. Good morning, good afternoon, good night. Thank you for inviting me to this presentations and to this seminar training. It is very important topic for us since I'm one of the part of the team working on the updating NIP implementation, national implementation plan in Bosnia and Herzegovina, which is currently ongoing, and we are expecting to finalize it by the end of this year. So this is the right time for this topic for us. I have to say that I'm not a gender specialist. By profession, I'm actually a chemist, mostly involved in chemical inventories, contamination assessment, and such, and contributing to development of strategic and planning documents in the field. So I'm here to present which experience we have until now, and of course I'm here to learn more about this topic. So I will share. Okay, you will share. You are sharing my presentation. Please, next slide. I will start from the NIP that is updated in 2016 for Bosnia and Herzegovina. And at that time, it was developed through the years from 2012 up to 2015. And at that time, not many people in institutions, NGOs, academia were really familiar with the issues of persistent organic pollutants. Still, at that time, plan already made some room for gender aspects, including one dedicated chapter for that, pointing out differences in exposure to POPs, but also stressing that everyone needs equal protection. We all know that women are often more vulnerable to hazardous chemicals, mainly due to biological factors like the reproductive system's higher percentage of body fat, where harmful substances can accumulate, and sensitive life stages such as pregnancy, breastfeeding, menopause, and so on. Keeping this difference in mind is crucial for designing effective measures and ensuring fair protection for all. So next slide, please. Bosnia and Herzegovina established a strong legal and institutional framework for gender equality. The law on gender equality and gender action plan define clear commitments for institutions. And also there are many commissions and special offices under the lower government levels as well. But I would say that still there is a long road from thinking of gender equality as just a woman issue to really integrating into the way we design measures and make some decisions and changes. Next slide, please. Here at already at this stage and NIP designed in 2016, we recognize that we all need a broader education. It was clear that awareness raising and capacity building would be essential in order to strengthen understanding of persistent organic pollutants and their impact on health and the environment. So actually we need from the start, we need simple steps, clear guidelines, trainings that include health and gender, and sharing material for everyone to involved. That actually help, that NIP recommendations help us to be baseline for creation of POPs project that was implemented by UNDP in period 2019 and 2025, which called Environmentally Sound Management of Persistent Organic Pollutants in Industrial and Hazardous Waste Sectors in Bosnia and Herzegovina. Inside of that project, many trainings, educations, technical or with the different topics were organized, and inside of each training, I would say, we talk about those health issues, trying to mainstream gender aspects through the trainings. And of course, I have to emphasize that through all workshops and trainings, special attention was given to ensuring equal gender representation here for the participants. And it is really important to stress that cooperation with the Foreign Trade Chamber played an important role when it comes to any topic regarding communication with the industry. Since it connects many different sectors, it was a great channel for collecting information, distributing channels, but also sharing the knowledge. Next slide. As a part of this project, we organized UNDP actually organized two specific trainings for the where with the gender aspects topic. One of them in 2021 and second in 2024. For participants from the different institutions, government institutions, but also one special training was organized for NGOs and representatives from media. We found that POPs project found that it is very important to train NGOs and media through workshops and trainings, because their role is really crucial. They need to clear scientific data, but also the skills to translate scientific.
You don't know the
Excuse me. Yeah, because they need to translate scientific terms into simple language for public, so that public can understand the risks, feel concerned enough to act, but still not feel into some kind of panic. At these events, we share the first research results of PCB levels in Bosnia and Herzegovina. Human milk. It was one research organized outside global monitoring program, but that information from that research really caught people attention. Many participants found it especially interesting to learn that human milk is regularly tested as a part of global POPs monitoring, and I think that that information should be more distributed through the media and NGOs. And the final slide, I would say I just summarize few conclusions, recommendations that I have. From the beginning, we need all more scientific facts and global monitoring results on the presence of POPs in breast milk, air and water should be more integrated into workshop and trainings on various chemical management topics. In that way, great interest and involvement of women in decision-making process will be achieved. Can you just go back to the last slide? Or I don't have any time. I just want to say that except the trainings, now we in our NIP, our plan is to, we are now in the stage when we already have identified priorities and the goals for the action plans. And now we will, our intention is to view it through the lens of gender equality. Also, our working group should include representatives of institutions who can support these projects. It is also very good that action plan should be reviewed by the competent gender equality institutions and require their input. That's what we will do here in Bosnia and Herzegovina for sure, because I have a good experience when I was part of the team working on the environmental strategy for Bosnia and Herzegovina. At the end, our action plan was reviewed from the gender equality institutions, and they really propose some good way to mainstream gender aspects into the action plan. And what else? It is very good to instead having separate gender equality activities. We should make sure that specific vulnerabilities of women, men, children, and other vulnerable groups are built into health and environmental policies in every way. So. Not only to organize gender aspects events, but to include that topic in each event that deal with human health and environmental protection. That's something that because whenever participants see that topic is gender, they will probably not be participate in some event. That's what that experience that I have from all trainings and workshops organized. So that's it from my side. If you have any questions.
Thank you so much, Melina. That's a very good progress from Bosnia and Herzegovina. Happy to hear that you're progressing with the NEP, and also you had a quite good progress on considering gender in your NEP. And a few points I made while I was listening to your presentation on it's truly important to have this human biomonitoring data when you communicate with the population, with the vulnerable groups, with those who are exposed to POPs, because this is the data of the people in this country being exposed, women and men, children, and people tend to believe numbers, right? People get more impressed with numbers rather than very abstract things of some possibilities that can happen. So data is quite important, but also human biomonitoring is quite hard, and it's tricky. The requirements are high, so not all countries can actually afford these programs, but maybe some of them are participating in different monitoring programs, and hope that this part of research will be extended, generating a bit of more human data on human exposure. Also, a few points as we spoke up with our colleagues in LAC yesterday. This project, all teams working on this project, they don't have gender experts in most of the case. So NEP teams do not have this provision in every country to hire someone who would be leading on gender. This is probably some lessons learned for future project designs, that these gender experts probably should be separate people from focal points and others, because definitely the people who has this expertise could bring a different perspective than technical, but more social perspectives. But as you rightly mentioned, it's good to include some gender organizations or civil society organizations in the process of endorsement, because they can give recommendations. And we have a very good amount of people from civil society. I was really surprised when I looked at the list of participants. There are so many organizations working on gender, intersection of gender and chemicals, and that are interested. So it's good to include them in the national coordination mechanisms. So they are consulted. They can really give great advices. I think it's a good point from you, and good learning for all of us to include these organizations in the process of validation and NEP endorsement. Yeah, I will stop here, and let me quickly ask if anyone has questions to Melina or would like to step in. Okay, if not, let me quickly invite our colleague from Armenia, Ms. Gohar Hojayan, communication specialist from Armenian Women for Health and Healthy Environment, also working on this project with us. So over to you, Gohar.
Thank you very much. It's a real pleasure to be part of this event, which is very important. And I know there are many of our NGO colleagues also participated in the LAC event. And here among participants, I see many of the colleagues that have been following the Stockholm Convention. So I work with the beautiful team of Armenian Women for Health and Healthy Environment. You see, it's a small team, mainly women, and they are mainly medical professionals, and I'm the communication person in the team. If you go to the next slide, I will briefly just introduce, just to mention that the NGO started in 1999, at the time when there was the negotiation for the Stockholm Convention started. In fact, if you remember, the Intergovernmental Negotiation Committee was gathering in those years. And the idea of this organization that we established was to look at the environmental and health effects on the women and children in Armenia, and especially we focus on the rural populations. Those who have less information, are have more burdens to carry. What are doing as part of the Stockholm Convention, in the implementation of Stockholm Convention, our NGO is member of the National Implementation Committee, and we are involved in the NEP update, in this one, in the previous NEP update also. So it's been a long cooperation. Our main involvement is doing awareness raising and information sharing, and we're involved in capacity building. But all these things are being done not in frame of the NEP update, but this is our daily activity. In whatever project we are doing, we have these components. On the pictures you see, there's the obsolete POPs burial site in Armenia, where we have experts, and our experts are also participating there, monitoring this site. And the next picture is one of the trainings that we do for our farmers, women farmers, that includes social entrepreneurship, making small enterprises, trying to learn alternatives to pesticides, for example, in agriculture. And the lower picture there just shows the alternatives, one of them. If you go to the next picture, to the next slide, please. Why women? So we are a women's organization, and we know perfectly well that women, as our also previous speakers have rightly mentioned, can be differently affected by persistent organic pollutants due to our physiology, our occupational exposures, and exposure to household products. And if you look at rural women, in the picture you see one of our good farmers in Lori province in Armenia, who has been involved in one of our projects. And this is what she's producing using pesticide-free approaches. She has a small enterprise. So they all have different experiences. And what we're looking at is trying to encourage them to be more participatory, to be involved in the decisions that are being made on the level of their communities, so that we have our joint vision for healthy environment for our children and healthy generation for Armenia. In our next slide, we can see examples of approaches to mainstreaming gender in the project implementation. As I said, we do not have specifically a project on gender, but what we do always, when we're starting from the design of the project, we are looking at the gender aspects, and we are looking at the gender disaggregated data, and we are doing needs assessment of those populations with whom we are going to work. So awareness raising is very important. And my role, I'm not a professional, medical professional or a chemist, whatever. I speak to people. And I try to explain in very simple terms about very complex issues, such as POPs that can be carcinogenic with endocrine disrupting characteristics, that can be mutagenic, and all these difficult aspects, and trying to give them a simple picture. And also, as our colleague from Bosnia has mentioned, not to frighten them off, of course, and immediately we speak about alternatives. That's very important, to give them a vision of how they can protect themselves. And it's not only just using the alternative products, which can be even more expensive sometimes, but looking at the ways we interact in our everyday life, looking at the healthy lifestyle, sustainable consumption, new business approaches, social entrepreneurship. So these are the things we're trying to speak to them so that they are not very much frightened off. For the capacity building, as I said, we are teaching about sustainable agriculture methods, available alternatives. And of course, one of our big portions of work is working with we have very good relationship with the national focal point for the Stockholm Convention. And this is where we're involved also in the NEP update, and we participate in the Stockholm Convention conferences of parties. And we work very well with the international NGO community. We work with the International Pollutants Elimination Network, Pesticide Action Network, Healthcare Without Harm, Health and Environmental Alliance in Europe. So you can see that we're trying to be multifaceted and bringing the women's issues and gender dimensions into all aspects of our work. And on the next slide, very briefly, just to mention Thank you. This is the example of a project that we are doing jointly with Albania, Armenia, Kazakhstan on NEP update. And our role is just to awareness raising. That's our component in this specific project. But if you look at the other slides, my last slide, in fact, there you will see examples of other projects by my organization that we are trying to incorporate gender components. It's not always possible to do all the components that we would want to do in every project. And one of the best examples that we have is the one that we're implementing now with the support of United Nations Democracy Fund. It is promoting democratic participation and climate smart agriculture in Armenia's 2 provinces, Kotayk and Lori. And there we start from encouraging women to participate in decision-making, to obtain training on climate-smart agriculture, and to boost their farms' productivity. And it's really working very well. And they are taking very good initiative. And there are other examples that we are doing with we have experience working with the government, with the national focal point, and also the international NGO networks, like with IPEN, we did a collection of information on chlorpyrifos in Armenia, and well, luckily now chlorpyrifos is on the agenda of the Stockholm Convention. This recent COP looked at it as well. So this is briefly what we're doing, and if you have questions, I would be happy to take them. Thank you very much again. Thank you, and these are our apricots to you.
Thank you very much, Gohar. That's really, really great to hear from all the progress from your organization working with a few countries in Europe and Asia region. Happy to see you are supporting also Kazakhstan. That's great. I made a few points as you were presenting that some of us, as you mentioned, you're also not a toxicologist, right? Not a medical expert, but it's so important when we also speak about the gender, when we identify these communities that are exposed to POPs, then it comes to awareness raising. So everything ends with the awareness raising, capacity building, reaching out to these people who should get this information about the POPs. And then the problem that arises is that POPs are so technical and so difficult. Just looking at the names, sometimes it's so hard to pronounce these long names, even for us. And people normally in the field and also rural communities, when we think about communities that are speaking different languages, sometimes indigenous populations, also people engaged in farming, so not really interested in these topics, not following up the media on these scandals with the chemicals, right? It's really hard to explain this term. So I guess it's also quite important to have someone on the team who can maybe be not a technical person, but also be able to convey the technical information in a very simple language, but also that will speak to both women and men through their social routine, so that they understand how these hazardous substances actually speak to their daily life in a simple word. So really great work on that. Happy to see you're progressing, and thank you so much. Maybe if any of our colleagues have questions, please feel free to jump in. If not, we will still have a time for discussions. But I've seen here on the chat that there was a comment that in some country, not mentioned here, they established the Women in Chemistry Symposium, organized gender mainstreaming, chemicals, waste management, and risk assessment. That's really great to hear. Some activities going on and women are being involved more in chemicals and waste. Unfortunately, chemicals and waste is not on the top of the agenda as a climate change, but good to see we have colleagues that are very passionate about this. And with that, I see Griffins joined us. Griffins, are you here? Great.
Yes, I'm here. Thank you. Hi, everyone.
Thank you. We have Griffins Ocheng, Executive Director from the Center of Environment, Justice and Development, and he has a very brilliant presentation and a few case studies for our colleagues in Africa, because we have several ministries from Africa today. I believe it will be very interesting for them to hear from you. Over to you, Griffins.
Thank you so much. It's a pleasure to be here, and thanks for having me for this presentation. And just to mention that, yeah, I'm based in Kenya, Nairobi, from Center for Environment, Justice and Development, and I will explain further, who has been working with Women Engage for Common Future for undertaking case studies in various countries through the support for the BRS Secretariat. And these case studies have been undertaken, particularly in Kenya and Tunisia, I think 23 years ago. And now we are working on additional case studies in Rwanda, Zambia, which is ongoing. So this presentation will present one which is already finalized, and there is a report which I will share. Like a code which can be scanned, but also mention some of the examples that we found in Rwanda, which we recently visited. So these are two projects that are looking at gender dimensions for projects that are undertaken by the BRS Secretariat for the countries that I've mentioned. So I will just first give about what CEJAD is for those who are joining and hearing for the first time about CEJAD. I also talk about what were the aim of these case studies when we're looking at the issue of gender, particularly in chemicals and waste management, and also bringing out some of the challenges that are faced at the intersection of gender and the waste, chemicals and waste management on the ground, and also reflecting on some of the solutions as well as suggestions or areas for improvement based on the guidance that I was asked to share in this presentation. So yeah, so just to give this, there's a code, one can refer to this. It's available in the BRS Secretariat website. If you look at the section on gender and the implementation of the BRS Stockholm Conventions. This report covered the case study in Kenya called Tackling Toxics, and also in Tunisia. So it was finalized in 2022, yeah. So just to be brief about CEJAD. So we are a public interest organization which was founded in Kenya in 2012, and we work across the African region. Particularly have been very engaged in the negotiation of the plastic treaty, but also implementation of the BRS convention, implementation, including global framework on chemicals, particularly issues of pesticides, which we are working in some other African countries in collaboration with the Center for Pesticide Suicide Prevention. I'm glad to see colleague also in this panel. And we envision a just and sustainable society free of toxic chemicals and waste. And our mission is working to safeguard human health and the environment from these harmful chemicals, with a focus on the vulnerable groups, children and women, which we are talking about today. We are a participating organization in a number of networks that are also been very working on these topics at the global level. IPEN, International Pollutants Elimination Network, Pesticide Action Network, World Alliance for Mercury-Free Industry, Zero Mercury Working Group, Gaia, which is also working on issues of zero waste, and then Break Free from Plastic movement. So our programs are covering the issues of plastic and waste, which I'll talk about today: mercury elimination, highly hazardous pesticide, lead paint elimination, and ozone and climate, which we are also working to implement some of the provisions under the Montreal Protocol, and there also has issues of gender mainstreaming, very critical. So, screen has frozen. Can you hear me? I hope you can still hear me. So just give the context. So these studies, case studies, aimed at looking at how are women and men differently impacted in their health by hazardous chemicals and waste, particularly in areas of occupational engagements, as well as when you look at the policies that are there in these countries. So we're looking at, and I think a lot has been talked about why women, for instance, and why men in terms of physiology. And when we talk about hazardous chemicals, looking at issues of POPs, persistent organic pollutants, recognizing that this webinar is organized under the auspices of also updating the national implementation plans in countries. We also looked at how do women and men occupation and their role, particularly at home and at work, influence exposure to hazardous chemicals. This case study particularly looked at those in informal settings in Kenya, for instance, and as well as in Rwanda, the areas that we've done the case studies, and these informal settings, which are occupational, how do they, for instance, men and women exposed to these hazardous chemicals? But just not looking into this, so the countries to inform the implementation of the national implementation plan and the integrating gender aspect, what best practices would, for instance, women and men in terms of leadership or in terms of their role, would substitute the exposure and minimize the exposure to eliminate the hazardous chemicals and waste. So this, for instance, if my women, and I'll give some examples, involved in some innovations, how do those innovations prevent them from exposure to these hazardous chemicals? And but also in terms of voices, in terms of their leadership, how are they involved in leadership in terms of decision making that impact their lives directly? So, but just a few case examples in terms of when we're looking at this case study, we're looking at also from the policy perspective. How do policy provide enabling environment for the gender mainstreaming and gender dimensions in chemicals and waste management? Of course, in a number of countries, there are good provisions looking at the issues of gender. For instance, in Kenya, we have the Constitution, which provide a legislative framework for implementation of national gender equality, which was a law that was enacted to promulgate the Constitution. And of course, other policies that are in existence on issues of gender and development. So for Kenya, there is actually a gender commission as well as a gender ministry. And this was cutting across even Rwanda that we also just visited recently. But importantly, there is a right to a clean and healthy environment, which is a right for all, and important recognition within the constitution of this country to provide that enabling environment for this group of people to work in a clean and healthy environment, not exposed to toxic chemicals and waste. So in development of these gender action plans, development of these NIPs, these already provide a basis as an objective to work towards embedding issues of gender and other populations to have a clean and healthy environment. Recently, there are other laws that were enacted, which has also recognized, for instance, in the Sustainable Management Act in Kenya, recognizes the informal waste workers, particularly waste pickers, for involvement and engagement in policy discussions and in actions, as well as in other regulations like extended producer responsibility. Similarly, same in Rwanda, which we just recently visited and engaged stakeholders. This is a picture of engagement with the Rwanda Environment Management Authority, where we found out that the constitution mandates gender equality, and this guarantees a minimum of 30% representation of all women in decision making. So these already provide policy enabling environment for involvement of women and in the aspects of gender in terms of decision making that all cadres of government takes. And the country has a target of representation, which already has 63.7% of parliamentary seats that are already held by women. But it also created some key institutions to advance gender equality, which was very impactful. The 3 Ministry of Gender, which is similar to what ministry in Kenya has. There's a gender monitoring office and a gender national women's council. And in this, the gender monitoring office ensures that the private sector also implements particularly gender budgeting. There are some budget amounts that relate to the issue of involvement of gender across all ministries, so that also incentivize the private sector to adopt gender equality measures. And they do audits through the gender monitoring office to ensure that these provisions are implemented. So talking about challenges, which probably has also been referred to, this video that we documented in Kenya, if you scan it, you see our situation in terms of the challenges, and not emphasizing what is already being covered, that in practices that happen in countries, for instance, we talk about plastics, they already contain these types of chemicals like brominated flame retardants, which are carcinogenic, and among other POPs that are listed in the Stockholm Convention. So the first challenge is how then do we have this non-toxic recycling that from the beginning prevent the exposure of, for instance, women and other populations from these chemicals, and including informal waste workers or waste pickers, so to say. In Rwanda, for instance, we found that many women work as licensed private collectors. So there's already an element to have them formalized, to be recognized, to be registered, and have regulated practices like that will prevent the exposure, like use of protective gear and health insurance, which is different in other countries like Kenya, which is already, the waste pickers already organizing themselves to be able to form cooperatives, and the 2022 law provided that enabling environment by that recognition. So this will, if you could see the picture on the right, is, for instance, men and women in the Rwanda dump site, which are already managed by a private that through the government, is provided them with these reflectors or PPEs that they wear when they are at work. But these are among the challenges that are there. When we look at some of the practices, particularly in Kenya, there is already some engagement of different groups to try to address the exposure by, for instance, managing organic waste through separation, collection, to produce biogas. So this prevents the burning, which is one of the bad practices indicated, addressed in the Stockholm Convention, that exposes to, the POPs like UPOPs. But also within other chemicals like pesticides, they are replacing the use of pesticides in some other forms of agroecology that do not use chemicals. Issues of workplace, ending gender-based violence. The women are also involved in various entrepreneurship for transition to green and circular economy, and also training on a smart agroecological system. So these are some of the practices that are happening, and there are some case studies in these countries which the report documents. And this is pictures of various forms of engagements that we found that many women are involved in Kenya. But the other aspect which is important is mainstreaming the following aspects in the policy development. For instance, when looking at issues of implementation for development of the NEP, the need for having scoping studies to look at the different impacts that women and men by sex can predominantly are faced with. Then these are aspects are anchored in the law to be able to provide that enabling environment. Of course, public policies reduce the burden of care in terms of affordable and other aspects. Importantly, also, as we develop these NEPs, the need for laboratory analysis to identify which are some of these POPs are in various plastic products that would expose the public. So there is also monitoring the chemical use and gender roles to specific resources that women would need. So these are some of the aspects that can be integrated in terms of gender aspect in the development of the policies or the plans like NEP. And so as a recommendation of ways to address this is this need for a multi-sectoral, multifaceted approach by government and other actors. So one is creation of this multi-sectoral, multi-stakeholder that brings together women across different occupational cadres, informal waste workers, waste pickers, among others, to be part of this multi-sectoral interministerial committees. For instance, starting development of the NEP, important to have this broad approach that addresses the issue of silos. And so this will ensure equal participation and leadership to advance the gender equality. It will also ensure that there are some needs in terms of capacity that are identified and the data, and that those can be filled up in a multi-sectoral approach. Access to finance and resources for gender equality and empowerment. So if there are resources in country, like for instance, from the Global Environment Facility, this multi-sectoral approach can be able to enable how these resources can be accessed from the government, and also where it can be distributed even to these groups, so that there's specific empowerment that can be need-based. But also important to have gender and equal transition to sustainable and toxic-free society. So as I conclude, this video or this code provides where you can scan and to get the video for the videos that we were able to document in Kenya. And this is still ongoing for other countries like Rwanda and Zambia, where we also, together with WCF, are working for developing these case studies. With that, I thank you very much. And these are contacts. I can share more experiences. Thank you.
Thank you so much, Griffins. I think that's a wonderful, experience sharing from the Africa continent. And I already made so many notes while I was listening. Especially as you mentioned about the gender data, because yesterday in the context of the LAC workshop, we also spoke a bit on this gender disaggregated data, how to get this data, and you rightly mentioned that it's necessary to also have some data sets on the human exposure to better organize this interventions with the gender integration in NIPS, right? But recently in June, we had an Africa POPs research roundtable in GGKP, where we had a few laboratories in Africa and institutes and universities, researchers in Africa that actually shared some data sets on human exposure that are available, including the colleagues from IPEN as well, that are creating this data sets on human exposure in Africa. So the data is available, even though it's very limited, but people, very passionate people working on it. We also had a very good point from our colleague in Jamaica yesterday on this data. Let's say for countries that do not have this POPs human exposure data sets yet, it would be also good to work, she mentioned, with the ministries of health that have the trends and statistics on the diseases that are associated with the POPs. So that this data can probably, maybe not directly, but indirectly be as a secondary or a baseline data for those working on NIPS and those who work on these, awareness raising campaigns and capacity building to bring some numbers on the diseases and the trends of these diseases from the health sector. So I see a few colleagues from the public health sector today here with us, and maybe it would be also helpful for them, but also for all our colleagues in the ministries working in NIPS. Again, one great point, working together with the community groups, with the civil society organizations, with those who work on the research and probably may have this human exposure data sets. It's good to have them included, and very, very well done on the overview of the policy, where policy stands and gender in Kenya and Rwanda. That's the great, I guess, progress, as well as the private sector engagement to also, bring private sector in the game, because many people are getting exposed being at their workplace, and some rules and regulations should be there also, and some activities shall be taken from their employers as well to inform them as a part of the work. Thank you very much, Griffins. I see a few comments on the chat from our colleagues in Africa that for many African states, inadequate PPE, low literacy levels among farmers on dangers of use of pesticides is what one study found on when we collected information in Zambia. That's one comment. And also another participant mentioned that gender mainstreaming is an issue we take seriously in our operations in the project, ranging from research protocol planning, implementation, reporting, and that they are planning to conduct a risk assessment, desk review, lead chromate toxicity, exposure routes. So a lot of research going on. I'm very happy to see that colleagues are actively engaged. And with that, if anyone has questions to Griffins before we move to our next colleague from Asia, please feel free to turn off your microphone, turn on your camera, or not turn on your camera, but speak. This is an open space for the dialogue. So we promoted our colleagues to panelists, and those who want to be promoted to the panel, Okay, I see Priscilla from Nigeria. She was with us in the LAC workshop. So Priscilla, we promote you to the panel. Please kindly join us. Hi, Priscilla. Hello.
Am I invited
Yeah.
to join as a panelist?
Yeah, you are. We hear you. Please go ahead. Okay, I think we lost the connection for a while, but we will reconnect soon, I guess, with Priscilla again from Nigeria. And in the meantime,
Hello, can you hear me?
yeah, I can hear you.
Okay. I was saying good morning, good afternoon, good evening, wherever you are.
Priscilla, I think the connection is breaking. So we move to our next speaker, but once you're reconnected, please let us know in
just
the
want
chat.
to thank Griffins for the presentation, what is happening. There are several policies. Can you hear me?
Yeah, I can hear you. It's
Yes or
breaking,
no?
but we can hear you now.
Okay. Yeah, the connection is not very good. I was just asking a question about the policies. How has Kenya, for instance, been able to mainstream the issues of gender into their policies, looking at it vis-a-vis the challenges that most of the policies are gender blind, and so working with the state and trying to review this is not, I mean, it's a huge challenge. It would be a good lesson for some of us that are working in this space if you can share what and how he has been able to get the government authorities to mainstream gender into their policies, and what are the review processes that has taken place. Over.
Thank you so much. Thank you for the question. Griffins, do you think you can address this question, or would you prefer addressing it later offline?
Oh, thank you so much. Yeah, I mean, I can reflect on that. Yeah, she asked about how the policies. Of course, I alluded to that some, but it's a work in progress for sure, because then you find that from, let's say, issues of informal waste workers, waste pickers, the policies has recognized this, because this is an area there is a lot of informality, and women are involved, particularly in the dump sites. But with the recognition in law and the organizing that the government is also putting up into cooperatives, this will provide some kind of enabling environment for addressing these challenges. Of course, when you look at the aspect of chemicals and waste, we are just working on improving our national implementation plan. There's specific, need for addressing the challenges with recognition of the challenges that particular groups of gender face. So that's an area that, in terms of implementation, is still an area that has to continue to be, focused on. And many organizations like us are bringing this to the fore in terms of, for instance, we've done studies that looks at the, for instance, chemical exposure in various certain type of products like plastics. So this would bring to the fore the scientific evidence that there is need for particular ways on how to address issues of plastics management, for instance, and of course promoting other solutions that are minimizing the exposure to chemicals, that encourage women to be taking more leadership role, sitting at the table in terms of decision making, among others. So I would say these are some of the areas of continued work. Thank you.
Thank you, Griffin.
Thank you very much. Sorry, just a follow-up question. When we talk about chemicals, how do we link these chemicals especially to climate change, and where the local farmers are concerned. Griffin, did
Yeah,
you
so
get my question?
yeah, so I will link this to the climate change. Yeah, so yeah, big question for sure. And my immediate reflection, for instance, when we're talking about waste, which include different streams, plastics, metals, aluminum, others. We've just come from discussions around big challenge of what plastics are. You know, it's oil and gas, it's chemical additives. And when these are burnt, it releases, these fumes that are also greenhouse gases. So there's the linkage that need to happen, particularly when at the national level, where not these different departments, and that's something we're promoting. When I talk about multi-stakeholder engagement, we need to have in the chemical space those that are working on the intersection of climate and biodiversity. All these treaties, all these conventions, they have to begin to work at national level where there is kind of synergy, so that they address this in a multi-sectoral approach, not in silos, because we are already talking about 3 planetary crises. There's already linkage, so that the interventions in chemicals, intervention that are taken in climate. I always see some programs that are promoting, to address climate change, but maybe promoting aspects of making bricks or making other products from, plastics or any other material. And yet we know within the Stockholm Convention, when this thermal process happens, it releases the chemicals into the environment, but also greenhouse gas. So there's that aspect of multi-stakeholder approach that is important at national level. The NBSAPs, the National Climate Change Action Plan, or the NDCs, including the National Implementation Plan, all these need to be begin to happen at the national level in a synergistic manner. Thank you.
Thank you very much, Griffins, and thank you for the questions, Priscilla. Priscilla, we will share with you a few slides later after the workshop that will help you better understand the interconnection between the chemicals and also the climate change agenda, because this is all well interconnected. While we are quite short on the time, and we still have one special guest to speak with us and share a bit of her experience. Let me here invite the Miss Shweta Dablokar, Project and Policy Officer at the Center for Pesticide Suicide Prevention. I actually met Shweta at the COP. It was a very fortunate, very lucky meeting. So we have Shweta today in the workshop. Over to you, Shweta.
Thank you so much, Anastasia. I just wanted to check with you if you're able to hear me.
Yeah, we can hear you well. Thank you.
Okay, I'm just going to share my screen. Are you able to see my screen now?
Yeah, we can see your screen. If you could put it in the full mode, slide sharing mode.
It is in the slide sharing mode.
Oh, not yet. If you go down, or would it be okay if my colleague shares the slides?
Yeah, that would
Then
be fine.
Join, if you could share it again, please.
I can stop sharing. Okay.
Okay, thank you, Johan.
Sorry. So will I have to tell you when I would want to change the slide? Okay. Thank you so much, Anastasia, and the organizers for inviting me for this event. My name is Shweta Dabolkar, and I work with the Center for Pesticide Suicide Prevention, which is based out of University of Edinburgh. Today, I'll be speaking about, my presentation is going to focus on the impact of highly hazardous pesticides and suicide poisoning. Next slide, please. So I'm just going to give you a brief description or explanation on what highly hazardous pesticides are. Highly hazardous pesticides are a very small minority of all pesticides, and they present particularly high levels of acute or chronic hazards to human health or environment. They are classified highly hazardous pesticides under the WHO FAO GMPM criteria. So all of POPs would be classified as highly hazardous pesticides, and if anything is listed under Stockholm Convention, that would be classified as highly hazardous pesticides as well, because of their hazardous nature. Now, despite their hazardous nature and all the hazards they cause to human health and environment, they are widely used, especially in the low and middle income countries. While they are seemingly banned in the high income countries, however, a lot of high income countries still manufacture these pesticides, and they continue to sell it to low and middle income countries. So they are as much a part of the problem. Next slide, please. There are different types of pesticide poisoning depending on the duration of exposure, source of exposure, and intent. It could be acute for short-term exposure, chronic for long-term exposure. Based on the level of intent, it can be occupational, accidental, and intentional poisoning. Most of the pesticides are available to agricultural communities. So based on their proximity and duration of exposure to pesticides, the type of poisoning would be determined. In terms of source of exposure, they could be individuals could be exposed through inhalation or contact or oral poisoning. Next slide, please. There are, in terms of causes and risk factors, there are, it is recommended to use PPE kits or safe handling, and a lot of different measures like lock-in boxes are suggested to prevent pesticide poisoning. However, there's a lot of evidence from low and middle income countries where these systems like lock-in boxes have not worked. Especially, they may work when it comes to occupational poisoning. They may reduce the risks involved in terms of occupational poisoning. However, self-poisoning, pesticide self-poisoning or suicide poisoning as it is known, it's very common in low and middle income countries, especially in South Asia. These highly hazardous pesticides are they are very commonly available in any shop. Anybody in India, for example, could walk up to the shop, buy a pesticide, and consume it. Most of the times in agricultural communities, highly hazardous pesticides are very easily available in their homes. So during a moment of crisis, if you have easy access to a lethal means of self-harm, then very highly likely you would be using that lethal means of self-harm to harm yourself. And because of the hazardous nature of a toxic chemical like HHP, the outcome is always fatal. So easy accessibility to lethal means of self-harm during moments of crisis determines fatality. And in this case, it being an HHP, there is a very high likelihood in terms of that exposure resulting in a fatality. Next slide, please. Farmers, agricultural workers, children in farming areas, in agricultural communities, pregnant women, and rural populations at large, especially, are vulnerable and are most at risk to to HHP exposure. Next slide, please.
Johan, I think it's a previous slide. Yeah, thanks.
Okay. Thank you. Yeah, I can see the slide now. Thank you. So it is important to discuss the topic of gender in chemicals because nearly 40 to 50% of agricultural labor in LMICs are women, and women and men have a different starting point. And when it comes to biological factors and social roles, biological factors associated with women and men are very different, and the social roles that a woman plays as compared to her male counterpart in a family system, in a community, or in a society is very different, which is often determined by unequal power and opportunity. Women do not have the same kind of power and opportunity that a man has, especially in low and middle income countries and from a South Asian perspective. Thank you. Next slide, please. So, for example, in terms of biological factors, HHPs are endocrine disruptors, and exposure to them during pregnancy and during lactation period can impact the child's health as well. Women have a higher body fat composition, which means they can store POPs like PCBs and dioxins for a longer period of time. And POPs are also linked to breast cancer, endocrine disruption, and reproductive issues. So they do impact a woman very differently because of the biological factors that are associated to a woman. Next slide, please. Now, in terms of social roles, um, next slide, please. In terms of social roles, it's very important to understand that women and men play a very different kind of a social role, especially in a region like South Asia. Men are the decision makers of the family, and women are not involved in decision making most of the times. Women do not have the same level of same kind of opportunities given to them, so they would not have the same level of opportunity to training or using protective equipment or making any kind of decisions associated to how they would like to work in the agricultural community. This is also reflected in the rate of suicides amongst women, not just in South Asia but globally. The rate of suicides has increased, and it has increased globally. Impact on a family when a woman dies when a woman is impacted because of a chemical, whether it's occupational poisoning or intentional poisoning or death. For example, if a woman dies by suicide, the impact of a woman getting affected is very different as compared to a man getting affected in the same setting. For example, if a woman is impacted because of the caring responsibilities that a woman would share in the family, the responsibility of care would now have to be given to someone else, and there would be some kind of a strain involved in a family, and they would have to look out for someone else to take care of those responsibilities. Also, if a man dies by suicide or is impacted due to occupational pesticide poisoning, now the woman has to shoulder the responsibility of both the caregiver and the financial provider. So here the responsibilities and the level of impact is very disproportionate. Moreover, in LMICs, if a man in a family has died by suicide, it's very common in South Asian countries. Pesticide poisoning is very common in agricultural communities. If a man has died by suicide, it is often associated with a great level of stigma. Being a widow is quite a big stigma in South Asian countries, and most of the times women do not have access to household properties, or they will not be given the same level of power in a joint family system had their husbands been alive in those settings. So sorry, next slide, please. So the level of impact is very different for a man and a woman. In terms of main challenges, lack of data by gender is a issue of concern. For example, many countries do collect data on poisonings, or they would report aggregate numbers on poisoning, occupational poisoning cases, or intentional poisoning cases, or deaths. However, they would not have this data by sex. If countries were able to collect data by sex, that would help in policy making, and also in analyzing what has been the impact of an intervention that had been introduced. Similarly, there are institutional barriers as well. Ministry of Women Affairs and Child Development is not often represented at international forums or conferences, or they are not included in making decisions. There is lack of coordination between chemicals ministry, health ministry, women and child development ministry, and agricultural ministry. If all the ministries could work together, everybody's interests could be better represented. Women are also underrepresented at a local level and a district level. Especially in India, there are local level civic bodies, and women are often underrepresented in those local civic bodies. So if their representation could be improved at local levels, that would also have a good impact. Next slide, please. So in terms of recommendations, if countries could collect sex disaggregated monitoring and exposure data, that would be great. Ensure women's voices in national implementation program committees and decision forums is included. If there could be a facilitation between health, agriculture, labor, and women's affairs ministries in every country, that would ensure everybody is equally represented. And in terms of accountability, if UNEP's gender checklists are included, um, for gender-based indicators and national implementation programs, that would also help. Next slide, please. So I think the key takeaways from this, next slide, please. I think that this is the previous slide. Yeah, thank you. So I think the key takeaways from this presentation would be that because there is disproportionate, sorry, I think it's the next slide. Thank you. So the key messages would be that because the burden is disproportionate, the solutions should also be very focused, and and women should also be represented, and the issue of gender should be discussed. And NIPs should not be optional. They should be it is critical and effective, equitable. It is necessary for critical, equitable, and for chemicals management. And we should have a call to action to ensure women's realities are visible in national strategies. Thank you very much.
Thank you so much, Shweta. I think you touched upon a very important, but also very, sensitive topic that not always is brought to a broad attention of the audiences. The poisoning, right? Countries that are very heavy rely on the agriculture, where most of the population is involved in the agricultural activities. They truly face the poisoning sometimes, but because of not knowing, of not having the information that this is dangerous. Because as I spoke with some colleagues from Africa continent that are also actively working the pesticide registers and those who work with the farmers on the ground, they say farmers are most interested in how this POPs pesticide is. So it's like POPs versus the crop. So they want to get the strong chemical that will address and solve all their issues in the field. But sometimes the hazardous effects of these POPs pesticides that come with using these POPs in the field is also some another issue that causes different consequences, including the poisoning. As you rightly mentioned, collecting some data, sex disaggregated data on the poisoning by the POPs pesticides. It's very important, not always there, not always collected, but I guess public health institutions could probably have this statistics. So for our colleagues who work on NIPS, and if the agriculture takes a big portion in your country's economy, I guess this is a good point to speak with your colleagues in the Ministry of Public Health on these statistics on the poisoning by the POPs pesticides. And this data will definitely be disaggregated on the Ministry of Health end by sex. So you will get some data set that will help you organize your future action plans and reach out to the right communities. Thank you so much, Shweta. I think we have 15 minutes more. We were planning one practical exercise, but there is no time for that, unfortunately. I put the questions from that exercise on the chat. So for colleagues who are still with us, please kindly look at the questions and feel free to put your answers on the chat while we are listening for Fuad with the end of his presentation, the second part of his presentation. So over to you, Fuad.
Thank you very much, Anastasia and colleagues. Let me just plug in my few remaining slides over here so we can. Okay, there we go. Can I have a confirmation whether you can see my slides and whether my slides are moving?
Sure, Fuad, your slides are moving. We can see them. Go ahead.
Perfect. Thank you so much. So colleagues, this is just like an example so we can basically, have a case study and visualize the dynamics here. This is an example from a context where we were working on the sound management of hazardous waste, including DDT especially, and other type of POPs. So when we looked at the situation, the gender dynamics within that given context, within that given geography of intervention, we found that, we have different roles played by women and men. So women were most likely to be in control of the subsistence outputs in the farm, while men were basically in charge of cash crops, where the money is. We found that women were, the main applicators of pesticides in women-headed households, while men were considered the main applicators of pesticides in general. Men tended to likely transfer pesticides using some type of vehicle, whether it's a truck, a car, motorcycle, bicycle. So women did not transport on vehicles, but they were transporting pesticides, usually on their heads and baskets. So women were the ones fetching the water that will be used for mixing the pesticides. They were the ones cleaning men's contaminated clothes. They were actually reusing the buckets and drums for fetching and storing water. So men on the other side were using the buckets and drums for, storing, spare equipments and doing activities around the land outside the household. So women were equally responsible for daily activities besides everything else they were doing in the land after pesticides use. That's the same thing for men. And of course, we also, noticed that mothers and children tend to spend relatively more time in the household sprayed with a DDT type, POPs for malaria control in that given context. So these were the observations. Now, why are these things happening? So why are women doing these roles and why are, men doing these roles? So basically, these roles are assigned based on, cultural and social norms in that given context. So women are not taught to operate vehicles. They're not encouraged to get driving licenses. There are different stigmas in different, contexts. That's why they're not transporting, pesticides on using some type of vehicle, but on baskets on their hats. They're washing clothes because it's perceived as a women's work. They are the ones fetching water to mix pesticide because it's perceived again as being a woman's job. And men are being, considered frontline users of pesticides because it's considered a man's job. And, because there is this toxic masculinity where they are perceived as invulnerable, and that puts them, in the front line of doing, let's say, risky job and riskier activities. So the consequences is that basically women are exposed to higher risk during the transportation of pesticides because they are transporting them using baskets on their head instead of a vehicle. They are exposed to the negative effects of pesticides. They do not know, they're not aware of the toxicity levels of different chemicals they're using because they had, little or no access to, let's say, education compared to their male counterparts. And of course, even when they are aware, sometimes they don't have a choice because they still need to make a living. And of course, there is a missing opportunity. If women are not aware of the hazardous impacts of chemicals, we are missing the opportunity of using them as our allies to convince their husbands and influence, the other household members to adopt safer practices around pesticide application. So on the other side, of course, men are more likely to have access or wear protective gear during spraying because they are considered frontline users. They receive training and awareness raising activities. They are more likely to wash their hands because of that awareness. They are also more likely to change their clothes after spraying pesticides. Now, it was very useful in that context to really understand these dynamics so we can kind of visualize the different pathways for occupational and domestic exposure, and differentiate between, such exposure using gender lenses by understanding gender norms and the stereotypes within that context. So basically, we identified direct and indirect exposure pathways. Women were actually likely to be directly impacted when they are doing mining the pesticides, from the burial sites, especially women living in the vicinity of these burial and storage sites. They were also involved in the trade of mined pesticides. Once these are mined, they need to be transported to the market or the place where they will be sold or transferred to the users. And of course, they are also like using pesticides in agriculture when they work in farms where pesticides are sprayed. They're indirectly impacted as well because of the reproductive and household burden, and of course associated with the roles attributed or assigned to women in that context. And basically they were primary care providers for the family members, especially, children, elderly, and men also, when they are exposed to hazardous waste. So in terms of awareness raising, basically what we have witnessed is that awareness levels remain relatively low, despite, again, all the work done on the ground because of the blind spots in how we design and target the groups of beneficiaries. And this leads to women ending up having insufficient training on the handling of hazardous waste and the use of pesticides. And of course, even when in cases where awareness is available, we still saw that, especially in women-led households, basically, because of the economic hardship and the underlying poverty considerations, they were still taking the risk of manipulating hazardous wastes and chemicals because they needed to secure a living for the day. So on the other side, we witnessed that men tend to be considered the most at risk, again, because of that perception that they are frontline users, they are the ones, spraying pesticides and using them. They were actually benefiting from training and awareness raising. On the opposite side, women exposure, remained more or less under-recognized. So these blind spots are very important to identify. In that context, that's actually led to the project adjusting the way we deliver training, awareness, and we interact with different stakeholder categories to ensure that, these gender considerations are not overlooked when we design and deliver our interventions. So these are like very few examples I want to share with you. It could be food for thought, it could be inspiration. I'm sure there are a lot of us doing these things already on the field out there, but it could be useful also to remind, other colleagues and maybe inspire them. So basically when we draft like TORs, tender specification, when we do remediation work, when we do testing work, when we hire teams to work on different like NIPS related interventions and activities, let's always try to make sure that we use gender neutral languages in the TORs. Let's make sure that we clearly identify the gender related responsibilities of the workforce. Let's make sure that we encourage candidates with previous experience in gender mainstreaming, who could really become the gender advocates, the gender champions in our work. Let's also make sure that we specify the composition of the workforce to be hired actually, and make sure that the underrepresented gender benefits from some positive discrimination, to make sure that we have a gender balance in our teams. And of course, one way of doing that is translating our TORs and bidding specifications into local languages. We have many countries where a dozen of local languages are spoken, and if we are not able to reach out to these people who speak the local languages, they will not feel empowered, they will not feel ready enough to apply for the job. So when we advertise for these jobs, make sure that we advertise widely and we disseminate the announcements through national networks of partner organizations, women advocacy groups. Let's make sure that we encourage female candidates to apply by using gender sensitive language. Women-owned businesses are encouraged to apply, for example. Let's also make sure that we are using non-traditional platforms such as social media, emailing lists, and reach out to women-owned businesses such as like startups, SMEs that are like women, involving women, or like that are women-led. I think by collaborating with women's organizations and networks, we're able really to reach out to these categories we're looking for. So when we organize a selection committee, let's make it a rule of thumb, every time it's possible, let's have at least one woman represented in any evaluation committee, if women are the underrepresented gender in this case. and include one question on gender in all interviews. So we did this in this specific case study, and it was really much appreciated by the stakeholders. So when we hire consultants and experts, we need to encourage the participation, of the underrepresented gender to make sure that we have kind of like, cases of positive discrimination where we allow for gender balance and gender parity in the ranks. Let's also, one of the things we have done is to make sure that we introduce positive discrimination when we also try to select vendors and suppliers. In case we're, as a tiebreaker, when you have like two proposals with the same score or cost, so in terms of cost effectiveness, the idea is actually to introduce this positive discrimination to ensure that we get the right numbers in terms of gender equality. So when we finalize contractual arrangements with personnel or consultants, it's a good practice to include the code of conduct on sexual harassment, and it's also very, very important to include gender-specific results in the performance of these collaborators and consultants to make sure that everyone works with the same accountability in mind in terms of delivering gender sensitive and responsive results. So when we have meetings and organizing workshops, it's very important. I think many of the presenters before echoed this in different presentations. Men and women, they have different behaviors within the society, and we need to consult both of them to make sure that when we convene training, awareness raising, consultations, whatever it is, we time it right, and it does not conflict, especially in the case of women who have to shoulder the triple burden of domestic, productive, and reproductive work actually, so they can be able to participate. Because of that workload, most of the time they are not able to attend a full day workshop. They are not attend a workshop where there are no services offered to where they can bring in their kids with them, so they can also attend and have their kids nearby. So I think it's super important to have these considerations in mind when we plan for these workshops and activities. So when we conduct capacity building, the idea here is to make sure that, we train not just the project staff, but also national delivery partners and other stakeholders on the gender consideration. So they're also like able to have that in mind and deliver gender sensitive training. We need also to make sure that, basically we incorporate gender specific modules every time we have trainings. We look at it from a gender perspective, from gender lenses. We bring in the gender expert together with the chemicals management expert, and we're trying to build something that is really gender responsive. And of course, we can also use women trainers, who could have an easy access to different population categories, especially in contexts where, a man cannot be training a women-only cohort in some given context. So when we deliver, for example, site activities in this project, it was a bioremediation activity to remove the soils contaminated with pesticides. So basically, we need also to make sure that we use sex and gender disaggregated data when we develop site-specific and risk management plans. And of course, it's also super helpful to explicitly encourage both men and women candidates to apply, join the technical teams, and get a job done on the ground, even by providing specific training to enable women and men to equally benefit from and work and contribute to the bioremediation solutions for low contamination soils. So what we have considered here basically is providing technical and managerial training, as I mentioned, and we also enabled, explored option to enable women to be employed closer to their homes, maybe just like part-time jobs, few hours during the day, so they are able to really reconcile their productive, responsibilities with the reproductive and household duties that they will still have to take care of. And of course, one of the other thing we put in mind is basically we were given due consideration to women of reproductive age, given the double risk, of having double contamination, an impact on maternal health and the health of the future generation as well. So they can be assigned low risk roles within the tasks, assigned to the workforce. So here I have a slide on closing the gender gap with different sets of data sets. These are like explained in details in the guidance. I think I just want to we can refer to the guidance to the specific annex with the whole detail and explanation. But I think I just wanted to pick on a few really important points that were mentioned today by Anastasia and other colleagues when it comes, for example, to conducting gender sensitive mappings and having sex disaggregated data related to the health impact. And this is, again, super important for us to be able to really explain and see in which case, sex and gender could differentiate the toxicological footprints and the impact on human health associated with exposure to POPs. So in some cases, countries can also conduct assessment of plausible relationships between gender-specific disease and occupational exposure to POPs. So you have a lot of data sets. We have seen in I think the presentation from Griffins, how we use the top-down approach, moving from what does the Constitution say about a human rights-based obligation to gender equality, and also like safe management of chemicals, the right of all citizens to a safe environment, a chemicals-free environment, and so on, and use it as an entry point to kind of like, also address the legislators, the regulators, and the policymakers in the country to make them more gender responsive, so we can have gender responsive legislation, regulations, and policymaking in the country, which gives you a very strong, a position in terms of our ability to mainstream these things and scale them down through the process of mainstreaming gender into our interventions. So I will not go into all the details. Again, the guidance is really it explains it all here, but we happy if there's time left for take any questions, happy to discuss this into details. Thank you so much again for everyone for your participation. It was a great workshop, a lot of inspiration coming from different countries. Please keep up the energy alive, and looking forward to continuing the collaboration. And over to you, Anastasia. Thank you.
Thank you so much for that really comprehensive overview of all the practical aspects of gender per se. Again, I would say the guidance is quite comprehensive and it's very explicit. We invite you to review the annexes. They have many recommendations explained in detail. But yeah, we open the floor now for all the participants to ask their questions. Questions maybe to Fuad or to other colleagues in the region. If you would have anything to add, please don't be shy. Let's break the silence. Let's have a bit of a dialogue on this if you would like to. Maybe anyone from the speakers, if you would like to add. Okay, I see one of the attendees raising the hand. We will promote that attendee to the panel to, okay, Kameni Edith Cecile, right? Okay. Kameni, can you turn on your microphone?
Hello, can you hear me?
Yeah, we can hear you. Please go ahead.
Okay, good morning, everyone, and thank you so much for this opportunity where we come to learn from others and as well share our experiences. So my question, oh, sorry, I'm Kameni Edith Cecile from Cameroon, and I currently work as regional coordinator for IPEN Francophone Africa. My question is quite general because we are talking of gender initiatives here, and I'm kind of just wanting to make sure, because nowadays when they talk about gender, it's not just to think about male, female. Yeah, personally, I advocate for the fact that gender has to do with male, female, but I just thought of asking to make sure, is it like just male, female, or you include other aspects of the gender here? Thank you.
Thank you so much, Kameni. That's a great question. I think Maybe if anyone of the speakers would like to step in, address the question, Fuad, or any others. Okay,
Yeah,
Fuad.
thank you. Thank you so much, Anastasia, and thank you so much, Kamini, for the question. I think it's a very good one. Basically, the quick answer is that, it really depends on your national context and circumstances. We have seen a lot of countries recently move beyond the binary definition of gender, going beyond the focus on men and women to a non-binary, definition that includes other population subcategories and social groups. So it really depends on your context where you work, your national kind of like framework to tackle gender considerations, and in line with that, you can move accordingly. Thank you, and over.
Yeah, maybe I could just add a very practical aspect to this comment that we always try to address men and women as adults, right? But also there is a big amount of children employed in the informal sector. We know in quite many countries where children are exposed to agriculture as well, together with their parents. In some of the countries, it's cotton picking or some other works in the field. And children can be exposed to the waste picking activities as well. So I guess men and women, it's a binary, I guess, concept of the gender. But also if you talk about the specific groups, aside from the adults, you could also think of the children. But yeah, I'd leave this to Fuad because this can be a little bit sensitive in terms of, bringing children to the capacity building awareness raising activities, especially underaged. We'll not delve probably in this, but if you have anything to add on that, Fuad, please go ahead.
Yeah, thank you so much, Anastasia. So the definition is broad here. So when we talk about women, for example, these could be indigenous women, they could be, different categories. Again, when we talk about the social and vulnerable groups, these could be children groups, especially in sectors where we have a lot of issues related to child labor. For example, in e-waste facilities where kids, are at the very bottom of the pyramid, by just like picking waste, using with no protective gears and so on and so forth. So it's really context specific, based on the country, based on the needs, based on the general understanding and definition of gender considerations. We have an evolving regulatory framework in different countries who have different definitions. There is no one kind of like globally recognized definition of what we kind of do in a given country or the other one. So I think it's really a work in progress. So look at your country, look at your situation, and again, if the environment is ready for you to kind of expand beyond a binary approach of gender by including other like social categories and so on, by all means, go ahead with that in that direction, and we can definitely discuss details.
Thank you so much. And I see a comment on the chat from colleagues from UNEP International Environment Technology Center. So it's regarding the guidance that there is a developed and released new Annex 6 as of May 2025 to the guideline on how to mainstream gender international waste management policies, focusing on waste. So there is a link shared in the chat for colleagues interested in the additional annex. We also will include this annex in the follow-up to this workshop as well. Thank you so much, Junko. Anyone else who would like to step in and share any insights, opinions, questions, or challenges, or maybe frustration over how to integrate gender in the NIBs? We had a very interesting discussion today, a few very great, I think, presentations on different experiences from our project countries and also civil societies that work. So how to summarize everything in one short summary of this workshop. But I guess we've learned a lot from the presenters. We've learned a lot from Fuad as well, from the guidance. From BRS Secretariat. So if anyone would like to step in, otherwise we wrap up. We are short of time, I guess. Okay, Probably not. Then let me take this opportunity to thank everyone who joined us today, who participated, who was very active on the chat. Many of us are not gender experts, so I guess probably people were quite shy to speak because it seems something that requires the expertise, but we are all in this boat together, working on the NEPs, not being gender experts in most of the time. So we invite everyone to join our group on Green Forum to ask additional questions on gender in NEPs. My colleague Johan will post a link to the community so we can keep this discussion and this dialogue going on the Green Forum as well. So let me take this opportunity, thank all our presenters, speakers, Fuad, Susan, Gohar, Melina, Shweta, Griffins, very wonderful presentations. Thank you so much. I can't stop learning from all of you. And we will be following up with all participants, registrants in this workshop with the more detailed information, the slides, the video records, and keep you posted on the next events of GGKP in September. Thank you so much, everyone. Thank you and goodbye.